Hi, I'm Andy Acton.
And I'm Chris Strevens.
This is Dentology, the Business of Dentistry podcast. What a absolutely passionate person.
You could feel it through the ether.
What I really enjoy is that when you talk to somebody who's passionate about whatever their thing is, you can't help but get drawn in.
I was going to say, I feel quite enthusiastic about Perio.
I think you're going to go and Google gum grafting. but genuinely, when you get somebody who's so passionate and so enthusiastic about it, and it's coming from a place of wanting to educate other dental care professionals, getting amazing patient outcomes, enjoying life, working hard, lots of different businesses. But the passion, it's quite infectious.
Yeah. And I think for me, one of the interesting things was that she didn't really like it to start with, and then has transitioned and is now a champion. And I think that also helps because she knows that what her first opinion of Perio was, which helps her communicate it to other people.
And has culminated in writing the Perio Handbook that's going to be available for people to get within a few days. Which
I thought it was really good, very enthusiastic.
Yeah, it was. Really enjoyable episode, that. Monday morning, 7 o'clock is my favourite time of the week.
I'm in my pyjamas.
No. It's podcast time.
Oh.
And today we have a legend of dentistry.
A legend. Don't you love a legend?
I'm not building too much for this guest, but we have the founder of RW Perio, Harley Street.
Should I do a drum roll, or is it a bit too much, Joan?
We could do a drum roll at the end. There's a lot to get through.
Yeah, there is, yeah.
She is also the founder of Perio School, the leading global teaching academy for periodontal courses. Has a product range by Dr. Reena, lip balm, tongue scrapers and breath sprays.
Oh, nice.
And the author of the Perio Handbook, which we're going to have a talk about today. And finally, I mean, if that wasn't enough, the host of the podcast, Life and Smile, we have Dr. Reena Wadia with us. Hello, Reena.
Thank you so much. No, it's great to be here. Thanks for the invite.
You've got a lot going on.
So much in one so young.
Yes.
I keep myself out of mischief, definitely.
Yeah, flipping it.
Mind you, there is that thing, isn't there? There's that phrase, if you want something done, ask a busy person.
Yeah, definitely.
And I think sometimes if you have lots going on, you have that ability to take on something extra.
100%. I think it is, I love being busy. I get bored very easily. So I'm always working on my next project. There's always something on the line. But I think it just makes it more enjoyable. So, but yeah, you're right. The more you do, the more then you feel like you want to take on.
Yeah. And juggling a family as well.
And juggling family. Yes, Ria is now 1. So, and she's already a cheeky madam. So yeah, that's another whole job in itself.
We always start asking about your childhood, your youth, upbringing. But before we get to that, just sticking with the busyness side of things, you're obviously a very successful entrepreneur. What would you say is the key skill that you need to be a successful entrepreneur? And I love the fact that you've got so much going on and it's quite diverse as well. You've got products, you've got an academy, you've got a dental practice.
I would say there's quite a few skills, but if I had to hone it down to 1 or 2, the first one I would definitely say is being organized, because when you want to get something done or launch a business and allow it to progress, I always find you only get stuff done if you're organized. So you being organized and then having a team who are organized around you as well, I think is critical, because I think I have to say a lot of the things we've done so far, it's thanks to my team that have made it happen and supported me. It's definitely not a one-man band. So the other thing I've found over the years is definitely being open to risk. And a lot of things, even for example, like when we moved to Harley Street, it was during the pandemic. It was a really challenging time, but we sort of pushed through that and said, okay, let's take this risk and see what happens. So I think it is about, and I've done that many times in terms of just saying yes to taking, it's calculated risks, but they are risks. So I would say, organization, having a great team and being open to risk.
Brilliant. So the people...
well, thank you very much, and lovely. Have a nice day. No.
That's it. That's all we needed.
That's it.
We call this a soundbite instead of a podcast.
That's right,
So the people that listen to this podcast, it's the business of dentistry, but they kind of tune in because they're interested in the people. The polite term is curiosity, or it's just nosiness. but they are interested in the people. So if we wind back to the beginning, what was your upbringing like? What was your childhood like? Siblings, parents,
Yes.
what did they do?
Where?
Yeah, so I grew up in South London and lived with my parents actually all the way up till even including university days. So I was a very much home girl. In terms of my upbringing, I was I'm very still family orientated. My parents, so I'm British Indian. My parents are, I wouldn't say they're traditional Indian actually. They're fairly modern, but they've still got those values in them in terms of hard work, putting your mind to things. And especially my dad, he always used to, still does, I guess, push me and say, look, just be the best you can and push through those barriers and break those glass ceilings basically. So a lot of the sort of enthusiasm I have and the foresight in terms of being able to go as far as possible is because of my upbringing.
What did they do? What do they do?
My dad actually retired now. He used to be an accountant. He does a lot of work with our local temple now, so he's involved in a lot of charity.
Right.
And my mum works for HMRC, so
wow.
it's a special combination.
That's an interesting blend, isn't it? Accountant and HMRC.
Yeah, I don't have any dentists in the family. The thing which drew me to dentistry was actually my local dentist. When I was much, much younger, I used to just love the way he used to treat his patients, the relationships he had with his team, and how he made you feel, essentially. And so I think I was like 12 or something where I thought, I think I'll be a dentist. This looks quite nice. And then it's just something, at that age, how can you decide what you want to do in your life? But it's something which I just had stuck in my head. Then, of course, I did work experience and everything else, but it's something I had stuck in my head and I just went for it and loved it. So,
and did you do work experience in that dental practice
I did.
as well?
Yeah, I ended up actually working in that practice in my first year.
Nice.
Sweet.
Manny Vassan, who's quite well known.
Oh, yeah.
So it was he was my dentist and I worked for my first year in that practice, literally 5 minutes down from where I used to live. So that was quite a special kind of 360 moment.
Yeah. Did you do work experience anywhere else?
Oh, so many places. I did work experience in like 20 different practices and hospitals and in laboratories and everything else. So
it's interesting you say that because I think we were talking to Samir Patel of 11 Dental a while back, and he was saying that one of the things that lots of associates do, which isn't necessarily great for them, is they don't move around. And I know this is work experience and you weren't an associate then. Yeah. But I think by moving around, it gives you a really good flavour for what it actually looks like. Because if you go just to one practice and it's terrible, your view is it's terrible. And if you go to one, it's amazing. Whereas if you go to lots of different ones, at least you get a fair blend as to what's good and bad.
Yeah.
I think also when you're young, doesn't it? I know we had one guest who basically they thought they wanted to do dentistry, wasn't medicine, wasn't quite sure, went and did Max Fax in hospital, then really realised they didn't want to do Max Fax. So then they were right, well that's something I definitely don't want to do. So then they were able to sort of narrow down what you do want to do.
I definitely think there is value in getting that breadth of experience at the beginning. I think longer term, it's nice actually to stay in places for many, many years because that's how you build your diary. I think definitely earlier on in your career to get the experience and the exposure and see what you like, I think, because otherwise you don't know until you explore. So on
that work experience, did you reach out and do it yourself?
Yeah, I did actually. And it's a bit harder nowadays with all the regulations, but I did used to just write letters or go and visit people and say, look, are you happy for me to observe? And it was really nice actually, because when I did ask people, they always said yes. And it is like people actually are out there to help you. You just have to ask. So that was, it was really reassuring. And actually it's funny because, so I mentioned Manny, obviously I did work there. A few of the people that I observed are now my referrers to this clinic. So it's like I've kept those relationships as well.
Wow,
well done. It was only the fact I was asking. We quite often say, as Andy was saying, that where you are now is grounded in where you were. And that sort of determination that you've got. You started at the age of whenever you started your work experience. Right. You basically wrote loads of letters or rang loads of people, whereas there's other people who don't.
Yeah, it makes a big difference. So you qualified from Barts in London.
Correct.
With a prestigious gold medal. Congratulations. It might seem a few years ago now, but that's very impressive. So you were saying about moving around. So when you first qualified as an associate, you did general work as an associate, and did you bounce around a bit before you decided that Perio was going to be your future?
Actually, I didn't. So I actually went into Perio pretty quickly. So what I realised is I did my foundation year, I did then I went into hospital. I did some hospital experience in oral surgery and restorative. But also just during my undergraduate, I knew I wanted to specialize. I knew I wanted to sort of hone in on one thing and do it kind of really, really well all day long. It's something that I found that I always wanted to do. But I actually wanted to specialize in prosthodontics when I was an undergrad. And then literally it's just in the SHO year, so a few years on, I realized actually probably I don't want to do that. I want to specialize, but I want to specialize in perio. So perio wasn't something that I was actually always interested in. I actually, as an undergraduate, didn't think it worked very well. It was boring. I didn't see the light at the end of the tunnel, but it was really later on I realized actually I really love this specialty. So after what happened was with my SHO job, I actually went pretty soon after into my specialist training. But the thing is, I did it part-time. So I was also working in other practices. I worked in Woodford. I had an associate job in Harley Street. So I worked in other practices and I studied at the same time, which I found super beneficial because I was then able to apply as I was learning. A lot of the other specialty programs that are out there, most of them actually are full-time programs. So you have to literally just be a student and then that's it. Whereas where I was at King's, so I did my undergrad at Barts, but then I did my specialty training at Guy's King's. We were allowed to do that sort of part-time as well, which was like absolutely brilliant.
I tell you what, I wonder whether, and I don't know, I'm just sort of making a summarization here, that because you weren't particularly infused with perio in your younger days, whether that effectively helps you communicate better, because you've sort of gone through that journey yourself where you weren't particularly interested in it and then suddenly you were very interested in it, and now when you're trying to teach and explain to people, you've sort of got a passion that you carry.
100%, like 1,000%, because I completely get it. And I think unless you're exposed to what perio is really about and how much benefit it can bring you, your patients and your practice, not just from a clinical point of view, from a financial point of view, I think then you realize, okay, this is actually a specialty which makes sense. But I just think as an undergraduate, you're not really taught that side of it. No one really talks about the surgical side, the aesthetic treatments. So, I only know this because I then obviously decided to specialize and then went through that program. So on having that perspective that, okay, I get it, guys, I get it. I understand where you're coming from really helps because then I can actually expose what it's really about.
And when you were doing your specialist training, was RW Perio always part of that plan? Did you see you do your specialist training, you'd get really good, and then you would have a specialist practice?
Yeah, I think it was always on the cards in terms of, I'm very stubborn, you see. I like to do things my own way. Like I want everything to be perfect and this specific equipment. And so as an associate, that was really, I had the best teams and principals that I worked with. I cannot complain about that. But there's obviously a limit as to how far you can push things. So the only way to do things myself was to set up my own clinic. But by that point as well, I had developed a really nice network of dentists and hygienists who would potentially refer to me. So it's a risk I wanted to try out and take. And initially I was literally just hiring out a room and paying a day rate, hiring out a room in Wimpole Street, one day a week. And just testing it out and testing, can I actually build my diary? And it did take some time. I remember my first day, my only patient was my dad. So Perio.
And he didn't need Perio. No.
He did actually. He's totally fine now, but he actually had some pockets, so we had to get that treated. And so it took some time, it took some patience, but that's how I initially started. And then obviously it's grown from there.
And what are the challenges that you face in marketing a specialist practice over a general practice? Okay, you had a healthy start because you'd already built your network, because obviously you worked across a number of practices, people knew who you were. But now you're obviously looking to grow the practice beyond that initial cohort. How do you kind of market your practice?
Yeah, so mainly I would say it's the main form of marketing for us is word of mouth and positive feedback from patients. So essentially for us, we get our patients largely from referrers, external referrers, dentists, hygienists, therapists. And I always say to our referrers, send us literally one patient and see how positive they are about the whole patient journey, because we've spent so much time and effort on that. I can guarantee they will be happy and we will get the results for you. And so what happens is the referrer then hears back from the patient, wow, that was amazing, got the best results, and then they send more. So that sort of cycle works really well. And we really look after our referrers. We do so much education for them, many events. I'm always keeping them in the loop. They'll all be getting the handbook, all that kind of stuff. So we really look after them as best as we can. So that's worked really well. We have a pretty good social media presence as well, which has been helpful, which just kind of amplifies what we're doing in our message. But yeah, I think like a positive feedback from current patients is really helpful. We do have a percentage of patients, probably like 20-30%, who come directly. So now, the dentist may not have made an official referral. They might have just said, you need to see a specialist. So they Google gum specialist, Harley Street or whatever. Or there's patients out there who just have bleeding gums and they have gum aesthetic issues. So we'll get those direct patients. So I think Google reviews really help with that.
For sure.
But we don't actually spend too much on other types of marketing. We found that like genuine stuff has actually really done the trick.
Do you still get resistance from some dentists or not really?
In terms of referring, it's more so that they say to us that their patients can't afford it, or they're not that motivated, but there are ways around that. Like I always say to them, it's all about communication. So have you explained to them, if you're talking about money, right? If you explain to them, if you lose one tooth, one implant is £3,000, and our treatment plans are around £2,000 for the whole mouth. So it's like, and if we can save all the teeth, right? So would you rather pay tens and thousands of pounds for implants or £2,000? So it's about putting into perspective. We offer interest-free finance. And then also there's such a strong link between gum health and general health. So making sure the patients understand that this is the foundation to anything else you do. So if you want orthodontic treatment or, bonding or veneers, you have to get the gum sorted. So yeah, we can get some, not resistance, but the referrers feel there are challenges when they're talking to the patients about it. But I do truly believe there are ways around that.
I just wanted dentists thinking, no, I don't need you. I can do it myself. It's fine.
No, we don't really get that. Like most dentists don't want to do the perio. Like, they hate it. So we're actually at an advantage. They're happy to ship it off if possible. So yeah, we don't have a problem with that.
It's interesting what you're saying about some patients effectively self-refer. They've spoken to their dentist, and I think that just serves that as patients, we're getting way better informed, and there's so much more information out there that they can actually find you themselves, which is quite, that wouldn't have happened 5-6 years ago.
Definitely. I think it's good. There's so much information out there. There's also a lot of inaccurate information out there as well. But they definitely, most of our patients will be educated before they're sitting in the chair. They feel like they know us through social media. They've seen our profiles, they've seen practice, they've seen photos, videos. So they already know us before they attend, which you wouldn't have many, many years ago. But definitely patients are educated. They know what they want. They know the different types of, even with surgery. I mean, I'm so surprised some patients come in and they're like, I want this particular surgery, which is quite technical for patients to come out with that. So, but overall, I think it's a good thing that patients are more educated now.
It's a lost opportunity for the dentist, isn't it, really? Like the dentist who just says, you need to see a specialist, rather than say, by the way, let me introduce you to a specialist.
But it enhances their credibility.
Because even if they don't generate revenue, they're generating goodwill, aren't they?
But they refer to you, and they're going to come back absolutely raving about their experience, which is then going to reflect well on the general practitioner.
And they're going to get a book as well.
Well, nice lead up to the book. So you've got your book coming out soon, the Perio Handbook.
Just going back to that, I think it's actually a really important point that it's so important to make the referral, because we can then keep the dentist in the loop, because at the end of the day, any specialist practice is an extension of the general dentist's care. And you're right, we are a reflection of their care because they've made the recommendation.
Yeah.
So us all communicating together and like looking after that patient the best we can is the most important thing. But yes, we have the Perio Handbook coming out. So I've been working on this for like 3 years now. It's been, this is like my first baby.
Is that how long you took to write it? How long it took to write it?
I started before I was pregnant, and then through my pregnancy, and then after. But it's been like it's taken a while. It's been on and off, just under 3 years. And but I've been wanting to do it for so long. And it's a summary of literally everything you need to know in Perio for someone working in general practice, whether they're a dentist, hygienist, student, and I've always, since I was an undergraduate, loved summaries. I just want to know what I really need to know, and in a really succinct summary. So this book is literally just that. It's got everything you need to know. It's a really
how thick is it?
book. It's about, we're on camera here. So
Oh, okay, yeah, cool. Okay, so a bit bigger than in my head what a handbook might be. I feel more like a pamphlet, but not a War and Peace.
I saw holiday read. That's what it is.
Yeah, it's like a weekend read. It's 250 pages. It's a really
brilliant.
easy read. It's got some really nice diagrams, and it's meant to be something you can just put in your office or on the surgery. You can just refer to. It's got key references in it. And the main thing is it will reduce your medico-legal risk, because right now Perio is at the top of the medico-legal. People getting sued left, right, and centre for Perio. So this will reduce your chances.
That's an interesting one, isn't it? That's got to be part of the sale.
I was interested in the subtitle, Reena, because the subtitle is The Complete Guide to Modern Periodontics. Has the way that you treat periodontics changed over the years? Are the techniques that you're working to today evolving and moving quite quickly?
No longer swig your mouth with
Definitely, exactly. So no, it has changed a lot from the clinical point of view in terms of the techniques we use. Like, for example, many of the listeners, they may or may not have heard of minimally invasive non-surgical therapy. So it's a style of non-surgical treatment we do. So that all the new surgical techniques that are out there for like things like gingival recession, but it's also the communication side and the treatment planning side as well, which has all been updated. So I think nothing changed in Perio for like a long time. And then the last sort of 5 to 10 years, so much has changed. So yeah, it's definitely worthwhile having
Is that new technologies or better understanding? Or
technologies, better understanding, more personalized care. We've got better evidence for certain types of treatments, certain types of materials. So it's all, science has just got better, and we are now all trying to follow evidence-based way of working. So and there's so many guidelines by the British Society of Periodontology and the European Society, which kind of everyone should be following.
Was there I'm just intrigued at the fact of teeth and gums been around for years, ever, and then periodontics. So was there some sort of catalyst that created that improvement in technology? What sort of suddenly spawned it, do you reckon?
I think it's overall in medicine, there's been a forward-thinking style approach in terms of bespoke care, personalized care. How can we get the best patient outcomes? And also now the kind of focus is not just clinical outcomes, it's also patient-related outcomes. Like, for example, like we care about pockets being reduced, but what does the patient care about? So I think there's been this whole mindset shift in the way we look at medicine in general, and dentistry's definitely Perio has followed that path. We've also, like, the whole big thing now is wellness, and investing in your whole health, and gum health is a part of that conversation. So all of that has probably fueled more research. And at the end of the day, I think in any medical field, you want to continue to advance and get better results for our patients. So all of that, I think, has fueled developments for sure.
You were saying the books for people in general practice, so dentists, therapists, hygienists. Will this handbook make them feel more confident in identifying and referring patients, or doing some of those early level treatments themselves before referral?
Definitely. It's the whole so the way it's broken down is the whole treatment and the whole patient pathway, from the first time you see them to the diagnosis, to the treatment planning, to the non-surgical treatment, and then surgery and referring. So it's the whole pathway with sort of tips and tricks along the way.
You can feel Reena's passion.
Oh, yeah.
It's like, rah. It's really interesting.
And when I was reading details before we started talking, there's a phrase I come across that you said it's gum aesthetics or tweakments.
Yeah.
Never heard the phrase before.
Treatment.
And does this form part of a wider aesthetic treatment that general dentists do, or is this something that a specialist periodontist would have to do?
Yeah, so aesthetics is a big thing now, and everyone always focuses on the teeth and the white aesthetics, but it's actually the pink aesthetics which are also just as important, which is the gum. It's like if you had a beautiful painting and you had the worst frame around it, right? You're not going to do any justice. So people are now looking at pink aesthetics. So gum aesthetics is all about, there's kind of two parts to this. Gum recession, so coverage of, gum recession, because people don't like long teeth. They're very aging. So more and more people want to have their exposed roots covered where possible. So we do a lot of gum graft surgery. But the other side is like gummy smiles or uneven gum contours. And there's all standards that we can follow. So we do things like to deal with that. So I think that's a lot of the surgery I do nowadays is related to that.
Can I be a non-clinician, Reena? What is a gum graft? So is this like you cut a bit of gum from somewhere else and stick it on another bit of where your tooth is a bit long?
Yeah, and we usually pull the gum down over it to cover the exposed root. And it's for people who are like really thin gums, who overbrush their teeth and they've got, problems and they don't like the aesthetics, it's progressing, they've got sensitivity. It's very, very common. I'll do at least one gum graft a week. It's super popular. Yeah.
Wow. And are we learning more about gum disease? We spoke to Victoria Sampson before, and she's doing a lot of work around saliva testing and the oral microbiome and inflammation. Is there a crossover with that work and what you now know about gum disease and how that impacts people's overall health and their systemic health?
Yeah, I think there's lots of developments in the links between gum health and general health. I think the two key conditions, diabetes and cardiovascular disease, are the most kind of got the strongest level of evidence. The other kind of conditions, there's emerging evidence, but we have to be careful here. I think with things like saliva tests, unfortunately, the science isn't there at the moment for us to be able to really use that in diagnostics, etc. Otherwise, we'll be doing it every day, and everyone would be doing it. But I think it's an area to watch. But I'm very academic. I'm very evidence-based. I only kind of follow things that I know for sure works. But it is a really interesting area, which I think is developing further. So it's one to watch. I think as minimum, we should all be talking to our patients about, Mr. Smith, I hope, do you tell them about gum disease? Then I'd usually say, the whole mouth is linked. Mouth is linked with the body. And if you have gum disease, you may increase your chance of risk of general health conditions. So let's use it positively, let's get your gums under control to minimize your general health risks. So I think patients do deserve to know it, but we have to just be really careful on what conditions and what level of evidence we have for certain things.
No, that's fair.
I hadn't realised Perio was so interesting, really, if I'm brutally honest.
Well, that kind of leads into my next point about you've got Perio School, your academy, and are people leaning into wanting to learn about gums and perio? It feels like we're in a world where all people want to do is straighten teeth and make them white, isn't it? We've got lots of practices that literally do aligners, bonding and whitening. And you strike me as a bit of an outlier. You're kind of doing gums. And is your Perio School of interest perhaps to younger dentists who see this as being a pathway for them in the future?
Yeah, that's an interesting question. Is there a demographic of your students?
There's been a massive surge in people interested in perio. Before, no one was interested in it. And now more and more people are realizing it's such a good specialty to get into.
I blame you. Honestly, I blame you because you're the person that's out there talking about perio.
I'm happy to take that blame.
No one else has spoken about it as far as I'm aware.
We need more people doing perio because there's such a need out there and such a demand for it. So I have to say, in the last 2 years at least, we've seen a lot more dentists and hygienists wanting to do more courses. We do lots of different courses, like online courses, one-day courses, weekend courses. But one of our most popular programs, we actually do a 1-year diploma course. So you get a postgraduate diploma in periodontics, and we are inundated with people wanting to do that. We've already filled next year. We're nearly half filled the year after. So what I'm finding is there are definitely people who want to take their skill to the next level in the world of perio, which is so nice to see.
Yeah. I think it's exciting as well because you obviously get to only see things from your perspective, and we don't see. So in another world, we value and sell dental practices, so we get to see lots of people's accounts, and at the moment there seems to be such a significant shift towards cosmetic type treatment. So to hear that you're booked up for 2025 and interest into 2026, it's great because actually, from the way you described it, it's a really important part of our overall oral care.
I love that. I love the phrase that I've never heard it before. I'm not a clinician. When you were talking about the pink aesthetics, I think that's I'd never really thought about that. You what's the point of having these super straight white teeth if you've got manky old?
Yeah, and dentists.
It's quite interesting what you were saying.
Yeah, and dentists are realizing that they want to do these great restorative treatment plans, but they're now realizing that if I've got a bit of extra skill, on the gums, like doing a little bit of crown lengthening, leveling the gums, then it will really bring their cases together. So it's all about trying to upskill, and you get the best results for the patients with those skills.
And
does the
sorry, I was going to say also, I'm fascinated by gum, what was it again? Bonding or something. Grafting, thank you. Does it happen in older people?
Yeah. So
Because all I'm thinking is they've got more money.
so it can happen in anyone. We have people in their 20s who are doing gum grafting on, because it can happen for different reasons. So I would say it's across the board that you can get gum recession. Sometimes gum recession is because of gum disease, which is then harder to address with grafting. We would do other things for that, but it can actually happen like gum disease. It affects the youngest patient to elderly. So it's all categories.
It's all ranging.
No one's left out.
Right. No one's left out.
And is your Perio School, do you deliver that in your practice? So they get to...
So we have correct. We have a teaching institute, and we have our hands-on facility in Harley Street, which is super fun because we can do lots of hands-on training. We've got technology now where we can do live streaming. So we have, like, for example, for our diploma students, I will do a live surgical case in the surgery here, and we'll stream it to the training facility. And one of my other colleagues will be interacting with me, asking questions. So it's amazing. It's so much fun. I think it's I like my week being mixed, but definitely the teaching side and interacting with other dentists and hygienists is always fun.
It's your passion, isn't it?
I was going to say,
you can tell the passion.
You love it.
Enthusiasm.
You found your right bit in dentistry. We talked to lots of people.
Gum grafted video. I'm fascinated by that. It's unbelievable.
But isn't it? Yeah, I think you can talk to anybody about anything, and you get drawn in if they're passionate about it. And that's why it doesn't surprise me that your course is sold out. More people want to come because they will take that enthusiasm from you.
Catch the fire.
Absolutely.
Look, I've never known so much about Perio since talking to Reena.
Enthusiasm for me is like the most important thing. In fact, in our team, we have a set of values, and we set 3 values for all of our team members. And one of them is enthusiasm. Because for me, I want you to like being here and being part of the team. And, if you're not enthusiastic, why are you doing it?
Yeah, for sure, definitely. For sure. So when's your book coming out, and where can people get it from?
Yes, so the book is going to be launched on the 10th of December onwards. It's going to be available on Amazon. And
is it like a big book launch?
Yeah, so 10th and 11th, there will be a special offer. It's actually going to be 99p on Kindle. So if you catch it then, you've got the offer. If not, afterwards, obviously Amazon, and then you can buy it through us as well. But Amazon's probably the best place to purchase it. And then we're going to be working on an audiobook so that you can listen to us whilst you're traveling, etc. So that's in the pipeline.
Brilliant. Would you buy one on my Kindle for 99p?
Yeah.
Would you narrate that yourself, the audiobook? Is that the plan?
I would love to. Yeah, I'd love to do that myself.
I think it makes a massive difference. Where I've listened to books that are just narrated by somebody else, as opposed to the author. I listened to Barack Obama's book as an audio book, and it's just so much richer if it's from the author.
Wow, that enthusiasm that Reena's got, can you imagine that in your ears?
Yeah.
Yeah,
as opposed to an AI voice. Absolutely kill it dead.
I would
no one would listen.
Myself.
Reena, we get to the time now where we need to ask you a couple of questions before we can let you go. Sure. So the first one is, if you could be a fly on a wall in a situation, where would you be and who would be there?
Really good question. Fly on the wall. Probably, I would love to be a fly on the wall at somewhere like Apple, where maybe Steve Jobs and his team are talking about the first iPhone and how they came up with that, and the creativity and the technology and the innovation. It would be amazing to witness something like that, I think.
Yeah, I mean, things like that they just changed industries, didn't they? And now we're so used to having technology like that in our hands, we forget what it must have been like at that very first moment where somebody said, do you think we could do this? That would be a great conversation.
Exactly.
I did while I was on holiday, I did a little bit of research. And did you know the balance of iPhone versus Android?
No clue.
51% Apple,
Oh, really?
49% Android. It's amazing that it's like split down the middle.
That's close enough, I thought.
Yeah. I thought it was fascinating. Sorry, it's a casual aside there, but I find small little interesting facts quite interesting.
Very
There we go.
There you go.
And our follow-up question, Reena, last one is, you could meet somebody. Who would you like to meet, given the opportunity?
Dead or alive?
Actually, linking back to your Obamas, I'd probably want to meet Michelle Obama. I think, I've read her book. She's amazing. I think she's very intelligent. Her ability to like connect with people. I also like how she balances ambition with just staying grounded at the same time. So I think someone like that, I would love to have a dinner date with for sure.
That'd be fascinating. I think there could be a future president in there as well.
Yeah, maybe.
Reena.
Oh yeah, of course. Yeah. Not Michelle, Reena.
Yeah.
For sure.
Maybe in another life.
Prime Minister, you might get something done. All political, but they're moving on there.
Reena, it's been wonderful. If you could give us some links as well, so we could drop those in the guest notes, so if people can find out more about you and also get your book as well, that'd be great. But yeah, thank you for your time today. It's been really good
And educational.
Exactly. Yeah, Chris is off now to do some googling of gum
Googling
grafting.
on gum grafting.
For a gum graft.
I'm going to book onto your course. Just have a look.
Lovely, Reena. Thanks for your time today.
Thank you very much. Thank you.
Keep well.
Thank you.
Cheers.
Bye.
Thank you for listening to this episode of Dentology, where we discuss the business of dentistry. If you like what you heard, please do subscribe where you found this episode. That would be amazing. And also follow us on Instagram.